Thank you, Mr. Chairman. Thank you, Madam Secretary, for being here. As you may know, the Catholic TV station, the Eternal Word Television Network, EWTN, is located in my home state of Alabama. And EWTN does not fall under the small umbrella of the religious exemption of a religious employer, nor do many hospitals, charitable service organizations, and universities. And I understand that you, along with the administration, are working on a, quote, accommodation for groups that fall in this category. But my question is, putting aside any future accommodation, why is EWTN and similar religiously affiliated entities not simply exempt from covering these services, especially when these drugs, such as the morning after pill and services, fundamentally contradict their moral beliefs?
Congresswoman, the Affordable Care Act made it clear that in the future, insurance policies should include health benefits essential to women's health care, and often they are missing. And so we asked the Institute of Medicine to give us an analysis of what were the key preventive health services for women. They included everything from domestic violence screening to maternity care to contraceptive coverage. We then looked to state law. 27 states in the country have mandatory contraceptive coverage, and we looked at the various kinds of exemptions that were currently present in the majority of states around the country.
Right, I understand all that. Let me maybe ask a more specific question.
That is why we developed the...
Right, let me get to that, because I only have a short amount of time, and the chairman is pushing us. Why are you defining some religious organizations as acceptable for the full exemption and others as only religious enough to qualify under some other defined
accommodation? We were guided by the exemption that was in place. We didn't invent this exemption. The exemption that was in place in the majority of states that had any religious exemption, and a number of them don't have any, is what we proposed, with an additional issue that we, in the year and in the ANPRM that we have just issued, will provide a series of strategies for religious employers who currently do not offer contraceptive coverage as part of their health plan to have the opportunity to employ one of these strategies. The mandate is not to the employer, it is to the insurance company. Insurance companies will offer preventive services to women at no cost to those women, and religious employers will not have to purchase or refer or pay for that coverage.
All right, we've talked a lot this morning about the preventative fund, and so I just have very quickly a series of questions, and I want to make sure that we're very clear on this, and yes or no is good. Is your testimony that without the preventative fund, there would be no more screenings for children anywhere?
Of course that isn't.
Okay. Isn't it true that the statute does not direct preventative funds to any specific program?
It's the prevention fund, and we have worked with bipartisan members of both the House and the Senate.
But does it direct that?
It does not.
Okay. And isn't it also true that the President's very own budget made cuts to the preventative fund?
The President's budget did recommend over 10 years a reduction in the prevention fund, certainly not an elimination of the prevention fund.
But there were cuts to the preventative fund.
There was a reduction in the prevention fund made in the President's budget, which would still leave about $1 billion+ a year to invest in these critical health programs.
Okay. And since I have a little bit more time, I'm going to circle back. I wanted to make sure I got these questions in. All plans after 2014 are expected to include coverage for sterilization and contraception, including drugs that some believe can cause abortion, i.e. the morning after pill that I've already mentioned. If an employer such as EWTN that I mentioned, the Catholic television station, has a moral objection to such coverage, what penalties will be imposed on the employers, or, as you clarified, the insurance providers?
Again, the mandate is not on the employer. This is a direction.
Right, okay, then the insurance providers, what penalties will they suffer if these employers do not offer these certain?
Well, those plans won't be certified to be sold in the market.
Okay. Mr. Chairman, I yield back.